All right, let's try it again, everyone. It's Wednesday, November the 10th. Unfortunately, we've got 44 more deaths in West Virginia. Some way, somehow, we've got to realize the only way we're going to stop this is first and foremost by the grace of God above. But beyond that, you know, the ammunition that we have at our disposal are the vaccines. And we know they're tremendously effective, and absolutely, you know, if you will just consider it, and just absolutely consider it for your children, and you know, I'm going to get into that a little bit as we go forward here and everything, but maybe as our numbers continue to rise, we'll make a real dent in this. But if we could make our numbers of vaccinated folks rise more quickly, it would be better. And from the standpoint of people getting their booster shot, in all honesty, if you've already been fully vaccinated, with Pfizer and Moderna, you've gotten your 2 shots, and with J&J, your 1 shot. And you're sitting around thinking, and I keep going back to what Dr. Marsh said yesterday, or day before yesterday, rather. But he said just this. If you missed this, he said, if you've got 2 shots, meaning you're fully vaccinated, Pfizer and Moderna, you've gotten 2 shots and you're 6 months out from when you got your last shot, it is almost of no value to you. Now, what he's saying is the vaccine's 6 months out, being fully vaccinated, your immunity level has dropped way, way, way down to maybe a level as low as 15%. And what does it tell you? It tells you just as simple as this: you've got to get the booster shot. So we need folks to get their booster shot, no question. We need our young people to get vaccinated first and foremost, absolutely no question. With all of that and everything, we've got to realize just this. I've said it and said it and said it. These vaccines are not bulletproof. They're not perfect, but they absolutely, for all we know, are somewhat harmless from the standpoint of the effects and the side effects and the negative downside of it. From the standpoint of what they can do, they can protect you for a period of time. And in that period of time, that's the bridge. The bridge for that period of time is just one thing: get us to something that gets rid of this forever. You know, it may run its life cycle and go away. You know, without any question, we may be able to get enough people vaccinated that it absolutely breaks the chain and it dies and goes away. But really and truly, absolutely, it's going to get colder. We're going to go more inside. And absolutely, there is a chance that it could get even worse. 44 more West Virginians have died. The 4,549th death is a 66-year-old male from Ohio County. The 4,550th death is a 54-year-old female from Raleigh County. The 4,551st death is a 68-year-old male from Braxton County. The 4,552nd death, a 55-year-old from Barber County. The 4,553rd death is a 59-year-old male from Tyler County. The 4,554th death, a 72-year-old female from Fayette County. The 4,555th death, a 76-year-old male from Raleigh County. The 4,556th death, an 87-year-old female from Kanawha County. The 4,557th death, a 71-year-old female from Preston County. The 4,558th death, a 68-year-old male from Raleigh County. The 4,559th death, a 72-year-old female from Kanawha County. The 4,560th death, a 76-year-old male from Morgan County. The 4,561st death is a 70-year-old male from Harrison County. The 4,562nd death is an 80-year-old female from Roane County. The 4,563rd death, a 78-year-old female from Grant County. The 4,564th death, an 87-year-old female from Berkeley County. The 4,565th death, an 87-year-old female from Preston County. The 4,566th death, an 82-year-old male from Mason County. The 4,567th death, a 91-year-old male from Ohio County. The 4,568th death, a 68-year-old male from Wyoming County. The 4,569th death, a 47-year-old male from Greenbrier County. The 4,570th death, a 64-year-old male from Preston County. The 4,571st death, a 79-year-old male from Wayne County. The 4,572nd death, a 66-year-old male from Kanawha County. The 4,573rd death, a 76-year-old female from Monongalia County. The 4,574th death, a 79-year-old female from Gilmer County. The 4,575th death, a 56-year-old male from Kanawha County. The 4,576th death, a 64-year-old female from Kanawha County. The 4,577th death, a 76-year-old male from Mason County. The 4,578th death, a 39-year-old female from Nicholas County. The 4,579th death, a 70-year-old female from Cabell County. The 4,580th death, a 65-year-old male from Monongalia County. The 4,581st death, a 90-year-old male from Kanawha County. The 4,582nd death, an 80-year-old female from Mineral County. The 4,583rd death, a 57-year-old male from Raleigh County. The 4,584th death, a 58-year-old female from Boone County. The 4,585th death, a 67-year-old male from Monongalia County. The 4,586th death, a 71-year-old male from Greenbrier County. The 4,587th death, a 66-year-old male from Monroe County. The 4,588th death, a 75-year-old female from Marion County. The 4,589th death, a 50-year-old female from Nicholas County. The 4,590th death, a 62-year-old male from Logan County. The 4,591st death, a 71-year-old male from Kanawha County. The 4,592nd death in West Virginia is a 71-year-old female from Lincoln County. I don't know how we can just get numb to the fact of losing 44 great West Virginians. It's terrible. 47-year-old from Greenbrier County. 39-year-old that we just went by here from Nicholas County. 56-year-old from Kanawha County. Way too young. Way, way, way too young. We've got 6,115 active cases in West Virginia, 857 new positive cases. Our daily positivity rate is 6.68. Our cumulative rate is at 6.13. We have almost 270,000 people that have recovered. There's a little uptick, in our hospitals, but not much. There are 544 people in the hospital, 190 in the ICU unit, 94 on a ventilator. We do have, some level of brightness here. We've got 9 green counties now. That's better. 37 school outbreaks in 17 counties and 587 people, kids, or people with the school systems that are confirmed. I remind everybody 65 and older, if you've got any kind of symptom at all, get tested, please. You don't want this. You're 65 and above, you do not want to fool with this. It's nasty stuff. And the process of death is absolutely terrible. The antibodies can very well save your life if we catch it early enough. I encourage you about wearing a face covering. If you have any compromising health issues at all and you're 65 and above and you're going inside with a bunch of people around, wear a face mask. Please do. The boosters, I've told you over and over, I don't know how to say it any more blunt. 2 shots, 6 months out, no help. 2 shots, 6 months out of no value. That's exactly what Dr. Marsh said. If you've lost your card, call us. We'll get you another one. We have now reached a threshold of 70% of the folks in West Virginia that are age 18 and above. That's pretty good. We're almost at 96% of those 65 and older. It's unbelievably good. 84.6, 50 and older that have had one shot. We're still absolutely, we still got a long, long ways to go. If you look at 62.6% of the people 5 and older have had one shot. We had to drop back because we added the 5 and olders, to the list and everything, but we'll get there. We just got to stay at it. Vaccine eligibility, 5 and older, just what I've said. I encourage our young people especially to get vaccinated. It's going to get cold. We're going to be indoors more and more and more, and absolutely through the winter and everything, this thing could jump very ugly, and so we need our kids vaccinated. That's all there is to it. We do not know, but we absolutely have many, many health experts that say that there could very well be lingering side effects with our young people that they could carry all through their life. They need to be vaccinated. More info up there on our vaccine info line. You've got all that. The grand families, $150 voucher and everything, if we can get more and more and more of those kids vaccinated. All the free testing stuff you know about. We always thank Frith and Walgreens for all that they've done. We had 37 outbreaks in our long-term care facilities, 1 outbreak in our church community. Way to go, church community. Just keep that up. We have, and that outbreak is in Nicholas County. We have 58 inmates and 20 staff cases. Corrections is still doing a great job. I remind you about your flu shot. Get your flu shot, and you can get your COVID shot at the same time. I always want to remind the people that are renters and or landlords, we've got money waiting on you. If you'll call us, if you're going through some level of hardship, we can help you there. I want to remind our veterans, of a great day tomorrow, a celebration of you and all you've given to each and every one of us. And I want to remind you about taking advantage of the state park discounts if they're there for you, and absolutely it's absolutely what we should be doing. I want to remind everyone of our virtual Veterans Day celebration or ceremony that'll be tomorrow. It'll air on social media and on TV on the West Virginia Public Broadcasting Channel 11. Channel, and it'll be at 11 a.m. on Thursday. There'll be different speakers. There'll be marching bands. We'll be featuring a show choir, marching band from Cabell Midland, and a show choir from Winfield High. It'll be a great day of celebration, and all I ask is just do this. If you know a veteran, any veteran that you may know, happen to be a mom, a dad, your mom or dad, take time to give them a call, send them a text, thank them. And if you happen to be out anywhere and you see somebody and you know they're a veteran and everything, buy their meal and pat them on the back and thank them for their service and thank them for what they're doing. You see an active military person, buy their meal, take care of them and everything. These people have given us every single thing we have in life. We'll be going out real soon with the Baby Dog Round 3, and that's all catered toward our youngest people and everything. We'll be giving away 25 prizes of $10,000 education savings prizes. We'll be giving away some grand prizes on top of that. 100 lifetime hunting license and everything will be given away. And this is every week. 25 $10,000 education savings fund prizes every week. Every week, 100 hunting and fishing lifetime license. 1 grand prize of the educational savings fund for a student, and 1 grand party at a school and everything that we'll be announcing later on when we get to the point where we've selected that school and that person. Yesterday, we went all over the place. We started, right here at Andrew Jackson and at Andrew Jackson Middle School, and we left there. Well, we were actually giving away $50,000 checks to schools that had the highest vaccination rate of the competition of all schools. There were 77 schools that registered for, to be in this competition to see who would be the $50,000 winner. We first went to Andrew Jackson, and you see Baby Dog sitting there, and she is amazed that stool is holding me up right there, right now. But nevertheless, I'm amazed that chair is holding her up, But nevertheless, she was with us, and we gave away a $50,000 check to Andrew Jackson Middle School. And then we left there, we went to Elkview Middle School, and same thing is going on right there. We're giving away that $50,000 check to Elkview. Then we went to Gary Elementary Middle School, and in Roane County, I was sitting there and talking to those kids, and at all the places, the kids were fabulous. They were just absolutely just the best of the best. But you'll see me, I'm kind of favoring my left thumb there, and from what I understand, the community is called left hand. And I'm the more that got in there and sat down, and I started talking and everything, had the microphone in my right hand and everything, and I turned around and looked, and there was a wasp sitting on my thumb, and it stung the daylights out of me, and I didn't break stride. I mean, I was a real trooper yesterday, but nevertheless, it got me. But and then we left there, and we went to Morgantown Learning Academy, and what a wonderful, wonderful school, and they also received the $50,000, and just really, really good stuff, and so proud of those kids and everything. They were all on their little mats, and they all sat out there. They were just perfect. I mean, if you haven't been in a school recently and everything, you need to do it. You need to see the hard work that our administrators and our school teachers and our service personnel are all doing. They absolutely, it is amazing. It is amazing how much these kids love their teachers, and they love, the cooks and the custodians and all the people, the principals, everybody that's taking care of them. The superintendents that came out yesterday, and just a lot of really good stuff going on all across our state. And so we're really proud of these schools, that had the highest percentage of vaccination, of the middle school winners. And so we're really proud of them. And we'll be going out. We've got 8 more. We've got 4 more elementary schools and 4 high schools that we'll be going out to in the days to come. As far as fuel shortage rumors that are going around, I understand that there's a few places where we've run out of gas and everything, but that's probably because, we're having a kind of run on the pumps in those areas. And so people are, excited about, the fact that maybe we're running out of gas here and there and everything. But overall, we're on top of this situation the very best we can possibly be. And without any question, we do not believe that there is a gas shortage, nor are we told that there is a gas shortage that we're going to have to deal with. We have talked with Marathon at length, and, there may very well be some minor delays, but with all of that, we feel very strongly that everything is at what we've been told. Now, if you can believe what we've been told that there is no gas shortage, there is nothing to be alarmed about, but I do sympathize with the fact that we have had a few places run out of gas, and if you happen to go to one of those places and they were out of gas, we understand. We understand wholeheartely, and but there are planned maintenance efforts. Is that right? There are planned maintenance efforts, going on right now within Marathon, and they're going to try to do better, and we're all going to try to continue to do better. But nevertheless, I just want to let you know there is nothing to be alarmed about at this time, as far as everything we've been told. So thank you so much. Okay, this one is something to be alarmed about, but I just don't get it. I really do not get it, and this has come from the Biden administration, but I guess John Kerry's our Secretary of State, and I'm, 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 I'm sorry, he's not the secretary. He's a climate czar, and so John Kerry came out yesterday and said that by 2030 in the United States, we will not use any more coal. Can you imagine? Can you honestly imagine, with the next statement will be, we're not going to use any more gas either. We're not going to use any more natural gas, and we're not going to use any more coal. And I will promise you this, we're going to use a lot of pharmaceuticals because we're going to have a lot of people sick. That's all there is to it. Because we're going to have a lot of people cold. Because we are not going to be able to keep up. Now you mark it down, and with the blessings of the good Lord, I'll still be here, and John Kerry too. 10 years from today, I would love to see the betting line where I could bet on what I feel today. I think it is totally frivolous to believe that we can do without fossil fuels in this country, in this world today. Now, do we want to embrace all the alternative energy sources? Of course we do. Of course we do. Are we concerned about anything, that may come up? Of course we are. Do we want the very, very best for the environment? Of course we do. But we want to be realists, do we not? And we don't want to purposely blow our own legs off in this great country while China is just churning like crazy, and India the same way, churning like crazy, promoting more and more coal production, more and more coal-fired power plants, and then we're going to just step back and blow our own legs off for the merits of the world, And absolutely, it is absolutely just nothing except catering to a voting bloc. That's all we're doing here, is we're catering to a voting bloc, and we know better. So I am amazed. Energy prices have gone up and up and up. They continue to go up. This winter, a lot of folks are going to have to make a real decision. And that decision is either going to be to try to stay warm or try to have enough food. Now imagine that in the United States of America. And we're out encouraging OPEC like crazy to make more oil or send more oil, to here or wherever it may be. I mean, really? And shut down the Keystone Pipeline or all the other pipelines and try to just restrict. And now, for the great coal miners of this country and everything that go there every day, put their life on the line and do any and everything they can to try to help us. And they've done it forever. And they don't really want anything. All they want is their job. All they want to do is grab their dinner bucket and be able to go to work. And for all those people and everything, we just turn and just slap them in the face. Act like what they're doing is bad and dirty and nasty. It's terrible. It's just terrible. And I absolutely do not understand it, nor do I understand a whole lot of things that's going on with the Biden administration today from a standpoint of what's going on with inflation and the border and Afghanistan and everything. When is enough enough? I mean, surely to God above, when is enough enough? We just got through with the Board of Public Works meeting and everything, and I think it went really good and everything. That's why we're probably a little late today. It took a little time, extra time there. The infrastructure bill that just came out, again, I thank, all those that voted for this and everything. It went through the Senate, with Senator Capito and Senator Manchin's support, and then over on the House side, and I know that there's bells and whistles about this, thing, that it may lead to the social spending bill and everything, but it took a lot of guts for David McKinley to step up and vote for this and everything, because he really knows just how valuable this is to West Virginia. It took a lot of guts to do that and everything, and let's hope and pray, and I think he'll stand dead staunch, and I know my feelings are exactly that. This social spending bill is ridiculous. It's just It's just a way to throw money at getting votes in the midterm election, and I'm sure he will. He'll stand, arm in arm with all of his brethren on the Republican side, and hopefully we can shut this thing down. With all that being said, again, I thank our senators, and I thank David, and I totally understand, the votes from our other congresswomen and congressmen, that what they're worried about, and they're right. They're worried about this social spending deal, that this may be a bridge to start the momentum to introduce this social spending bill of $3 trillion or $4 trillion. Do we have any comprehension of what that is and what that can do to this country and everything? We don't. I mean, none of us can even fathom a number like that. Yet we just want to do that to throw more and more and more money, and everything we throw more money at in that regard is not building infrastructure. It is creating more and more socialism. That's all there is to it. And if that's what we want to be in America, we can just absolutely video all the places of the world where this has happened and what has happened to them. What has happened to Venezuela? What has happened? I mean, it doesn't take a rocket scientist to figure this out. But from the infrastructure bill, think about this just a second. There's going to be $3.76 billion come to West Virginia for highways and bridges. This is what David McKinley voted for. $3.76 billion come to West Virginia for highways and bridges. $312 million for public transit. $43 million for airports. $768 million for energy and natural resource priorities, including $700 million for the abandoned mine lands, reclamation. An estimated $600 million for broadband development, and nearly $487 million for water and sewer investments, for a grand total of dollars coming to West Virginia of $6 billion. $6 billion that can come for the betterment of West Virginia. We thank Congressman McKinley, we thank Senator Capito, and we thank Senator Manchin and all those that stood up. It was a difficult vote. I understand both sides of it. I understand it through and through. But really and truly, we've got to first and foremost look after our home state. And this will be tremendously beneficial for our home state. The only other thing I've got is tomorrow, the grand opening down on Route 35 on Veterans Day. It's the final section. It costs $257 million in the Roads to Prosperity program. And, and what a day, what a tribute and everything. I hope you'll join us. It's a big time celebration. It's been 53 years in the coming, but it's finally here. So good stuff. Thank you a bunch.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Good morning. I want to add to what the governor has said, and certainly we appreciate the leadership of our congressional delegation for the infrastructure bill and for many other things. But I think it's really important that we also focus on the health of the people in this state. And the governor has made some fairly, I think, important and provocative remarks that we should all pay very, very much attention to. We mentioned the last press brief that our RT number, our reproductive value, is going up in West Virginia. It is 0.92 today. It was 0.83 about a week ago. We know that states where the weather is getting colder and people are going inside, like in Colorado, now in Michigan, and in Europe and Germany and other countries, their cases are starting to go back up, and they're starting to see more problems with the spread of COVID-19. We also know that we still have a number of people in West Virginia that are not vaccinated with first or second shots. And we know that we have a very large group of very, very vulnerable people that have not been vaccinated with boosters. And both of those cause me a substantial amount of anxiety as we start to look at the winter months that are coming up, because our hospital systems were very much stressed and strained to the limit. And currently, with staffing issues, we want to do everything we can to protect the access and functioning of our hospital system. So the governor talks very clearly to people, and sometimes maybe I don't. Let me speak really clearly if I can. So number one is we know that this pandemic won't either go away or become an endemic, meaning that it may occur in a yearly basis like the flu, or less, until we get our population, which means in West Virginia, in our country, and then eventually in our world, to have immunity, active immunity at an 85 to 90% level. Currently, we are about a 51 to 54% level. So we have a lot of room to grow and help people become vaccinated, because we know full vaccination is the way there. We also know that right now, about 276 people out of 4,592 deaths who have died in West Virginia from COVID-19 have been fully vaccinated. And the rest of people, over 4,300 of the 4,500 or almost 4,600, have not been fully vaccinated. So full vaccination is very important. When it comes to looking at the impact of vaccines that have happened 6 months ago, which is the booster issue in the United States, that's 6 months from your second vaccine with Pfizer or Moderna, or 2 months after your first vaccine with Johnson & Johnson. We know that your protection from developing COVID-19 again, particularly as you're older, goes substantially down. In Israel, we know that for people over 65, I believe, the benefit was 13% in people who were 5 months. We are talking 6 months now, 5 months after their Pfizer vaccine. So we know that boosting is critically important for us to have current immune status, not only for protection against death or hospitalization, which is really important, but to stop COVID from spreading so that we can get back to our normal lives. And that only happens when people are vaccinated. And when we look at our highest vulnerable group, our group of West Virginians over 50 years old, which has accounted for 97% of our deaths in the past, we see that there are about 550,000 West Virginians that are fully vaccinated, yet we've only given out about 48,000 boosters. Now, people are confused, and maybe some of our pharmacies are confused about who's eligible for boosters. Let me, in the governor's way, try to be very clear about this. Every West Virginian over 18 years old who has gotten 2 shots of Moderna or 2 shots of Pfizer and is 6 months from their second shot, or 1 shot of Johnson & Johnson, who's 2 months from their first shot, is potentially eligible for a booster if you decide to get it. And we would encourage every West Virginian to get a booster shot at this point. Pfizer is applying to the FDA and the CDC to make it that every 18-year-old is eligible. And given the criteria that the CDC has released, then we believe that every West Virginian who wants a vaccine, a booster, is eligible to get one, and please get one. And we've talked about that you can mix and match. If you've had 2 shots of Pfizer or 2 shots of Moderna, you can follow and get the 3rd shot with Pfizer if you got 2 shots of Pfizer or Moderna. And if you've gotten 2 shots of Moderna, you can follow with a Pfizer Moderna. If you got a Johnson & Johnson shot, we would heavily recommend that you choose an mRNA vaccine. And I personally would suggest, based on the data we have, that you would choose Moderna. Now, really exciting data is starting to come out from Israel to suggest that people that got the boosters with Pfizer, remember, Israel's a Pfizer almost solely vaccinated country, that the booster seems to be effective for a much longer period of time. They're measuring now and predicting it maybe 9 or 10 months effective at this point, where the amount of antibodies go way up, but it also persists longer and they're more effective against the Delta variant. So really important that people get their boosters, and particularly in our older age group. And ultimately, as we see our R value go up, as we see other countries and other states where winter is approaching, where people go inside more, see the spread going up, we cannot afford in our state to see COVID come raging back again, because we have too many people that are at risk of dying. And with all the goodness going on and with all the goodness we have in our state, protecting our people should be our #1 priority for our future. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
So I guess I'll pile on today what the governor and Clay have just reinforced. Again, as Clay pointed out, our RT value is up 0.92. We know that when our RT value goes above 1 and stays above 1 for a consistent period of time, we will see a surge in cases and then a follow-on delayed surge in hospitalizations, followed by a delayed surge in deaths. So we've got to continue to reinforce not just first shots. And the good news related to first doses is that today, 18 plus population, we hit 70% of that population. But as the governor and Clay pointed out, it's not just the first and second dose, it is the booster dose. And we need to really ramp up our efforts in those areas. Hospitalization numbers, as the governor pointed out, while they have now dropped and plateaued to a degree, we still have a significant number of West Virginians in the ICU and on ventilators, and we know that we lose a significant number of those patients. So we've got to continue to double down on this. Our community health clinics, our pharmacies and other locations, our health departments are distributing and providing pediatric doses. You'll see a lot more of our school community-based clinics providing those vaccinations here as we continue to move forward. We do not have any issues with supplies of vaccines, and we have plenty of booster doses. And I would again ask you, if you're confused about whether you're eligible for a vaccine, or if you have an issue identifying a location for a booster or a vaccine in general, please contact our hotline. Those folks do a terrific job. They do great work in making sure our West Virginia citizens get taken care of. And Jordan, if you could, just please put up again those who are eligible for the boosters. And again, we've tried to make this simple. Clay and the governor have laid it out simple. If you're over 18 and you've had 2 doses and it's been past 6 months, go and seek out the booster. Last thing I would leave you with is I want to express my appreciation to all of our veterans for tomorrow on Veterans Day. But also I would ask all West Virginians on Veterans Day not just to think about our individual veterans, but think about their families, and particularly think about the Gold Star families, those who have lost a loved one in the service to our nation. Our military families sacrifice so much for this nation, and they go unrecognized. And I would just ask you not just to recognize the veteran, but recognize the family. Thank you.
Thank you, sir. Dr. Inam Jad and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Good afternoon, everyone. It's just a strike of noon. First of all, thanks to the governor and thanks to General Hoyer for the shout out to the military members and their families. My daughter is a second lieutenant in the United States Army, and very proud of her, and we appreciate her service and all those that serve in uniform with her. In fact, she's going to be a guest this weekend on my show, Inside West Virginia Politics. So if you want to meet my daughter, tune in. I want to drill down into these numbers a little bit because they are concerning. If you look at the number of people eligible, 18 plus, 1.4 million people, if only 48,000 have gotten their booster shot, that's just 3.3%. The other side of that is the Delta variant has surged up to almost 7,000 cases now. I want Dr. Marsh to address if those two numbers are related. And what is the state going to have to do to get more people to get booster shots? 3% is, last week it was 48,000. This week it's 48,000. That's a jump of just 3,000 people in 1 week. That's not a significant increase. So do we need another incentive program for the adults, for baby dog, or what are we going to do to try and get those numbers up?
Guys, let me, Mark, and I'm going to defer, I guess, to General Hoyer and to Dr. Marsh in just 1 second, but I've got to just say this, and y'all know me, I try to speak in very common terms and absolutely not leave anything misunderstood. Try to be completely truthful all the time, or not try to be, am. And without any question, be transparent. Here's a straight deal, and this is all there is to it. If we don't get a bunch of people that are taking the booster shots, you can mark it down. A bunch of those people are going to die. That's all there is to it. It's just as simple as that. And how can that be explained? If you absolutely went and got your shots to be vaccinated, surely to goodness you think that you were moving to do the right thing. And if you're still here, you're surely not, we surely haven't lost you. And so with all that being said, to be hesitant and to be putting off your booster, to be out playing in the sunshine and whatever it may be, a bunch of you are going to die. A bunch of you. Now, we cannot keep these numbers at what Mark just brought them out. But anyway, Dr. Marsh, you go, and then General Hoyer, you go, please.
Thank you, Governor, and thank you, Mark. I think, Mark, you're spot on. When we look at the impact, and I'm now looking to Israel and other countries that have really effectively boosted their population. Remember, before the boosters in Israel, they were seeing 70% of their people in hospital beds in Israel be fully vaccinated. And after they boosted their population, they now see that same percent of people in their hospitals being the unvaccinated. When we look at our own hospitalizations, even though the numbers have come down from our absolute peak, which happened on September 24th, we know that about 25% of people in our hospitals today have been fully vaccinated. And so that really tells us that the potency of the vaccines are waning in these people, and we absolutely need to get boosted. So I would say, Mark, that your math is correct, but really importantly, we know that the majority of our deaths, even though we're seeing younger people now get impacted by the Delta variant, which is really important, the majority of our deaths are over 50 years old, and that we know that there's 550,000 people that have been fully vaccinated and only 48,000 boosters have been administered. So to me, I'm very much focused on how do we get our older West Virginians, who, as the governor said, are at the highest risk of dying as the vaccine potency starts to wane off. These are people that absolutely should be run into the fire, and we'll run to them if they raise their hand at all, because that their future is our future. And the concern that I'm having more and more and more is that we're losing our focus. And maybe people are not concerned anymore for some reason, but we could see another substantial surge and we could lose a lot more people. And our hospitals at this point have been stretched as much as they can be stretched. And so we also run the risk of having our hospitals very much impacted by that. So there's so many opportunities for us to get people vaccinated, to get people boosted, including our younger children to get vaccinated, because we know that transmission happens from children just like it happens from adults, and children can be impacted. So getting vaccinated with your first and second shots, really important. But right now, we have to run to the fire about boosters. And I personally don't understand why people aren't doing that now. I really don't.
All right, thank you, Mark. Next, we'll go to Evan Bevins with Ogden Newspapers.
Thank you. I was wanting to see what kind of response you all have seen since ages 5 to 11 have been eligible to be vaccinated. I know General Hoyer mentioned there's not a supply issue, but just wanted to see if you had any numbers on how many kids have been vaccinated and what sort of response you've seen in that age group. Thank you.
Evan, thanks a bunch. General, please go.
Yes, sir. Evan, I don't have an exact update today, but we'll get one to you, and we'll have an update as we close out the week on Friday. But we're seeing about right now the same percentage that we saw with the 12 to 17, and unfortunately, that's about at the 40% rate. It's not nearly what it needs to be.
All right, thank you, Evan. Next to Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking a moment for my call. Congratulations to Andrew Jackson for winning the 50 grand. I'm a proud alum of that junior high / middle school. Of course, when I was there, it was the Raiders, not Crusaders, but that's a different story. I have a question for the governor and Dr. Amjad. Roger Topping, the administrator at Mercer County Health, has resigned. He said effective 30 days within the board, took up a motion and made it effective immediately because of the snafu and the vaccine dispensing for the 5 to 11-year-old crowd. I'd like to get your reaction to that move by both the governor and Dr. Amjad. And also, Dr. Amjad, you promised to take a look, and you've said that the incorrect dosing was taking place in other areas of West Virginia. What other areas have you found where that incorrect dosing has been taking place, and what steps have been taken to fix those problems? Thank you.
Well, let me lead off. And Kenny, I don't say this to rekindle sadness and everything, but I know you just lost a beautiful companion, and I think it's either Misha or Misha. I'm not real sure, but our pets, our dogs, our companions are children to us, and we love them. And I know Kenny really lost a child, and it's sad. It's really sad. And so Kenny, I thought an awful lot about you, and I really have, and I know that's it's maybe those that really have never had a companion and everything. It's unbelievable. It's just unbelievable. What they give you in your life, and they never look at you with a bad day. And so Kenny, we've said a bunch of prayers, and that things will be okay with you. And I hate it. I hate it really bad. Kenny, in regard to the Mercer County situation, I think Dr. Amjad's got to answer that, because I know surely not nearly as much as she knows about this.
Thanks, Governor. Kenny, to answer that couple of questions. So our Bureau for Public Health did go down to Mercer County yesterday, and the Mercer County Health Department was very cooperative. Several Board of Health members were there, and they did do their investigation as far as vaccine error goes. As far as personnel issues go, the Board of Health takes care of those issues as far as Mr. Topping goes. So any questions with that, we would prefer you address those with their Board of Health members. As far as across the state, anytime there's a vaccine error, we go through several processes with that. So if there's a county that has any errors, our Bureau for Public Health will visit that county, address those issues in a systemic manner, make sure that policies are in place. We just want the vaccines to be administered correctly so that there's not any errors. So those things are conducted. the health departments, any systems that need to be corrected are done so that they can be done properly. So those things are done. Policies are put in place so that the vaccines can be done. But those things have been corrected across the state. But anything in Mercer County was fixed at a county level, and then the personnel issues are addressed locally. So that was taken care of yesterday at that level. Thanks.
All right, thank you, Kenny.
Back to me just one second. I got one more thing to say. From time to time, everyone knows that Kenny's asked me some tough questions, and he's pinned me down on a lot of things and everything. But I'm going to tell you this, and I mean this with all my soul. You can always tell someone's heart, about how they respond and how they deal with companions in their life. And by that, I mean a little dog or a little cat or a little pet or whatever it may be. Absolutely, with all in me, you can always tell their heart. And their heart is, then told in how they care about our state. And so nevertheless, Kenny, thanks a bunch for being Kenny. Thank you.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everybody. A couple of weeks ago, Dr. Marsh referred to a statistic that Israel was not counting people to be fully vaccinated until they had received their booster shot. I was wondering if by referring to their 60% of West Virginians that are fully vaccinated now, that is kind of ignoring the fact that you're not really fully protected unless you get the booster. And if there's been any discussion out there about changing the way we count vaccination and vaccination status for the dashboard and among the leadership team there. Thank you.
Dr. Marsh, I think maybe you can answer this.
Thank you, Governor, and thank you, Paul. One of the issues, Paul, is we do have reporting requirements to the Centers for Disease Control. So there are agreed upon definitions of what needs to be reported. I think your point, though, is extremely important and very well taken, because as the governor said, as I've tried to say clearly, we know that in order to really protect our people, it's not just the 2 vaccinations, which is absolutely step number 1. And anybody who hasn't received 2 vaccinations is at risk of getting sick or dying of COVID-19, no matter what your age is. But the older you are and the sicker you are with other medical conditions, the more likely that that person will be you. And if you've gotten your vaccines, particularly in our most vulnerable population, we vaccinated those people first in the country. So we have a lot of people who are older, who are sicker, who've been in nursing homes, assisted living, who've been vaccinated, first of anybody in those categories in the country. So they are at much higher risk. The governor has talked many times, as we all have, about Kaiser family saying that we are the most vulnerable state in the country going into this. We have the lowest, the shortest life expectancy by the CDC. We have some of the most chronically ill people in the country. And I'm not saying that to in any way reduce the love or appreciation we have for people in this state, but we're really worried about the people that are fragile and vulnerable succumbing, dying from COVID-19. And these boosters are an effective way to prevent that. So we are absolutely with you, but because of reporting relationships and because of consistency, it's likely we'll continue the way that we're reporting, but your comment is very well taken. Thank you.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Dr. Morris, I wanted to ask about what you said about what they're seeing in Israel with the effectiveness of the booster shots. Does that indicate to you that in 9 to 10 months, we're going to need to encourage folks to go back and get a 4th shot? And then, 9 months after that, is this going to be something we have to keep back going and doing? Thank you.
Before we go to Dr. Marsh, Charles, if that's the worst that happened in our lives, so what? At the end of the day, and I don't say that smart eloquently at all. I say it as what I've said over and over. If that's the bridge that we've got to take, in order to get our scientists and our medical community and all our people to come up with something that stops this and shuts it down, my gosh, living, I'll be the first to sign up. I mean, I'll be the first to sign up. If every 9 months or whatever we've got to take a booster shot for 2 or 3 series of times in order to get to the end of this, and we know how safe the booster shot is, I'll be the first to sign up. Dr. Marsh, please.
Thank you, Governor, and thank you, Charles. We haven't seen the data from this yet, and that's going to be important. But the really, to me, cause for optimism is that we know that the first 2 shots have a beneficial time, highest potency of about 2 to 4 months. And then after about 4 months, we see a fairly marked reduction in potency over the next couple months. So after 6 months from the first vaccine or 5 months, we're seeing a very much diminished potency. And this is particularly true now with Pfizer, which is what a lot of the reports have been on. But it's also really exciting that the booster, which comes fairly substantially after the first 2 vaccines, may actually have a real beneficial effect, because the first 2 vaccines were so close together, they may not have really boosted in the way that we would ordinarily think. And this next shot might have done that. So they're following it now, and they're seeing that there is maintenance of potency for a much longer time, which should give us cause for optimism and some celebration. And we are still following, Israel, and they will submit the data, and we'll look at that as a scientific community and the FDA and the CDC to decide when and if we would need more boosters. The other caveat, though, that's so important, which is the reason why this call to arms about getting people vaccinated, all of our age groups, and then boosted, for our over 18-year-olds who are qualifying is so important, because all this talk is really really depends upon the virus not mutating markedly from where it is today so that the vaccines still work with the same potency. And the fewer fully vaccinated people we have, the more likely the virus continues to mutate. So, depending on what happens to the virus, a lot of this conversation could change. But right now we do have a window to really get at the vaccines and protect our people and stop the continued mutation and new variant production from the virus. Thank you.
All right, thank you. Governor, I'll turn it back to you.
Well, I guess I've got 2 things that I've made a few notes on and everything. There's, my feelings about this are just as simple. I think any frog that's not proud of his own pond is not much of a frog, and I've said that over and over. I think in the state of West Virginia, we should always be really, really proud of our natural resources and the contributions that they've made to this great state forever. Whether it be coal or oil or gas or timber or water, whatever it may be, we should be really, really proud. Now, with all of that, in order to really get this state really cooking and really going, we had to diversify this state. And we've done so in many areas. Manufacturing, high-tech, medical, tourism has exploded in West Virginia. We've done all kinds of things to make that happen. I celebrate, Secretary Ruby and all the great stuff that she's done. Absolutely, this state is moving in a terrific direction right now. But with all of that, I go back to just this. I go back to the men and women that go get their dinner bucket and go to work. Whether they're going to work building a gas pipeline, or whether they're working, at a wellhead, or whether absolutely they're going back in the ground some thousands of feet, and many of them that are powering this country from a metallurgical coal standpoint and making steel. Imagine this now, because you may not even know this, but many of them are working the entire day at a mine height not much higher than what I'm pointing to right here. Maybe 40 inches. They can't stand up. They can't even sit up all day long, all day. And yet they're 5,000 feet underground and absolutely working in that condition all day for us, for this great country, for the world. And so to thumb our nose at those people, to thumb our nose at who we are, no way. Not from me. Not from me under any and all circumstance. There's a lady right now that's going for confirmation in the Biden administration. A confirmation to be, I guess, head of the currency. Just imagine this. That's going to be what she does. And she's going to be the person, I guess, that passes out the money or whatever it may be. Her comments are just this. She's a Harvard professor. Her comments are what we have to do in the years to come to get rid of coal and gas is bankrupt the coal companies and bankrupt the oil and gas companies. Now imagine. She may absolutely be one of the key players in the Biden administration. I can't go along with this. There's no way in the world that I'll ever forsake the great work that all these people have done, coal, oil, gas, timber, water, all the great work that these folks are doing in West Virginia, and I am tremendously proud of that. I'm tremendously proud of our state. The last thing I'll say is just this. We all embrace the alternative energies. Today we'll either burn up in the summer or we'll freeze to death in the winter if we believe we can do without our fossil fuels today. There may be a day we can. And when that day comes, we'll celebrate that day. Absolutely, but today, there's no possibility. So nevertheless, I want to again thank all those people that have given so much and all those that we've lost. It's been tragic beyond belief, but all those that we've lost. Thank you for your hard work. Again, I celebrate tomorrow, Veterans Day, and I thank them for all that they've given because everything we have, we owe to them. And so, absolutely, I encourage you in every way to reach out. Reach out, a hand of thanks. And the other thing, we've lost 4,592 people in West Virginia. And absolutely, this Thanksgiving is going to be dog tough for probably a lot of those folks. And I ask you to remember them in your prayers and reach out to them as well. The last thing I've got is just this and all there is to it. If you've not gotten your booster shot and you're fully vaccinated, you are making one bad decision in life. That's all there is to it. If you keep putting it off, you're making a bad decision. You're making a terrible decision. You made a good decision in getting vaccinated. You're still with us today. Absolutely, if you still continue to hesitate about your booster shot and thinking that you've got enough, you've done enough, you haven't done enough. Everybody in the medical community tells you loud and clear, the shots you have worn off. You got to get that booster shot. That's all there is to it. So please do it. Please have a wonderful Veterans Day, and absolutely just know that I mean it when I tell you I love you, and I mean it when I tell you I'm proud of West Virginia and proud of our great people. So